Surgery is a big deal, and it can come with a lot of potential complications. If you're a fan of Grey's Anatomy, you might remember a scene where Meredith Grey lists the 5 causes of fever after surgery: wind, water, walking, wound, and wonder drugs. While you definitely won't be tested on these, as a patient, having a little knowledge about what can happen after surgery can make a big difference. It may help you recognize warning signs early and even prevent some complications altogether. So in this video, we're going to walk through some of the most common post-surgical complications and what you can do to help prevent them or spot them as soon as possible. I've added timestamps so you can jump to any topic you're most interested in, but I encourage you to watch the whole video so you can better understand what to expect after surgery and how to support your recovery. Number 1. Low oxygen levels. This is actually pretty common. A large meta-analysis published in 2025 looked at nearly 29,000 patients and found that about 16% of people develop low oxygen levels after surgery. Why does this happen? First, anesthesia affects your breathing. The medications used during surgery can slow your breathing and make it more shallow. On top of that, factors like smoking, heart disease, obesity, older age, or poor physical conditioning can increase the risk. A big reason for low oxygen after surgery is something called atelectasis. This is when the small airways in the lower parts of your lungs temporarily collapse, often because of shallow breathing while you're under anesthesia or resting after surgery. When parts of the lung aren't fully open, your body doesn't get oxygen as efficiently, so sometimes patients need supplemental oxygen after surgery. The good news is that there are ways to help fix this. One of the most important tools is an incentive spirometer. It helps you take slow, deep breaths that reopen the lungs and clear mucus. Another option is a flutter valve, which also helps expand the lungs and move mucus out. Both of these can be prescribed by your doctor or your respiratory therapist after surgery. And just as important, movement. Once your surgeon says it's safe, getting up and walking helps you take deeper breaths, reopen the lungs, and lower your risk of pneumonia. Movement also helps prevent blood clots, which brings us to number 2. Blood clots, medically called deep vein thromboses or DVTs, can sometimes develop after surgery. They form when blood pools in the veins, usually in the legs, and this can happen for a few different reasons. Certain medical conditions can increase the risk, including cancer, pregnancy, obesity, kidney disease, infections, diabetes, and some genetic clotting disorders. But one of the biggest contributors after surgery is immobility, simply not moving as much while your body is recovering. According to a study performed by the CDC, about 1 in 100 surgical patients develop a blood clot, so this is definitely something doctors work hard to prevent. One of the best ways to reduce risk is movement. Once your surgeon says it's safe, getting up and walking helps keep blood flowing through your legs. Of course, the amount you can move depends on the type of surgery, whether it's orthopedic, heart, or abdominal, so always follow your surgeon's instructions. Because movement can sometimes be limited after surgery, doctors may also prescribe blood clot prevention medications for a short time. These might include aspirin, apixaban, or Lovenox injections. It's important to take these exactly as prescribed unless you develop complications like bleeding. Which brings us to number 3, anemia. Your blood is made up of several components, one being red blood cells. These cells contain a protein called hemoglobin, which is responsible for carrying oxygen from your lungs to the rest of your body. When your hemoglobin level drops too low, it's called anemia. After surgery, 50 to 90% of patients can develop anemia. There are a few reasons why. First, some patients are already anemic before their procedure. Second, there's the obvious one, blood loss during surgery. Third, large amounts of IV fluids given during surgery can temporarily dilute your blood, making your hemoglobin appear lower than it actually is. Fourth, doctors may need to draw blood frequently for tests, which can slowly lower your red blood cell count. And finally, inflammation from the surgical site can slow down your body's ability to make new red blood cells. All of these factors can combine, leaving you temporarily anemic after surgery. Sometimes anemia develops slowly over time, and the body gradually adapts. But when anemia develops more suddenly after surgery, people may notice symptoms like fatigue, weakness, shortness of breath, dizziness, or a racing heartbeat. If you experience any of these symptoms after surgery, it's important to let your doctor know right away so that they can evaluate and treat it if needed. Number 4, constipation. Not being able to have a bowel movement after surgery is extremely common. Several things contribute to this. Anesthesia, pain medications like opioids, and reduced movement after surgery can all slow down your digestive system. On top of that, many people are eating less and drinking less water right after surgery, which means that the bowels aren't being stimulated as much to do their job. For some patients, it can also simply hurt to have a bowel movement. If you've had abdominal, heart, or hip surgery, using those muscles to push can be uncomfortable, so people naturally try to avoid it. So how do you prevent constipation? A few days before surgery, you can increase fiber in your diet or drink more water. After surgery, doctors often prescribe medications to help keep things moving. These may include stool softening agents like Miralax or milk of magnesia, which help pull water into the intestines to make stool softer. You may also be given a bowel stimulant like Senna to help wake up the bowels and get them moving again. Using these medications together, along with staying hydrated, eating well, and walking as soon as it's safe, can make a big difference. If you want to learn more about managing constipation, check out my full video on constipation. I'll link it here. Number 5, low appetite. A lot of people notice that their appetite drops after surgery, and honestly, that's not surprising. Your body has just been through a major procedure, you've received several medications, many of which can cause nausea, and you may simply feel exhausted. But even if you don't feel like eating, nutrition is extremely important during recovery. When your body doesn't get enough nutrients after surgery, it can slow down wound healing and weaken your immune system, making it harder for your body to fight infection and repair tissue. Poor nutrition can also make you feel more weak and fatigued, which may delay recovery and sometimes even extend hospital stays or require rehabilitation before going home. And the truth is, good nutrition actually starts before surgery. The American College of Surgeons recommends increasing protein, whole grains, vegetables, and water intake in the days leading up to your procedure. Protein in particular is important because your body needs it to rebuild tissue and heal surgical wounds. After surgery, it's usually best to gradually advance your diet as tolerated, starting with lighter foods and working your way back to normal meals. I've linked a helpful guide in the description that walks through how to safely advance your diet after surgery and support proper healing. So remember, the most common things we watch for after surgery are low oxygen levels, blood clots, anemia, constipation, and low appetite. Knowing what to expect can help you catch problems early and take simple steps to recover faster. And when in doubt, always check in with your doctor. For more medical tidbits, please subscribe. Thank you.